Rare are the pigeon fanciers whose pigeons never have to cope with respiratory affections. Especially during the racing season, that is in the summer months, such problems crop up. Even in cases of mild infection, no favorable competition results can be expected. Pigeons who have to cope with respiratory problems certainly never attain a good condition. Important losses are also noticed. These respiratory affections are known to us under various names. Consider among others such affections as head disease, snot, dry snot, coryza, swollen heads, ornithosis, and even ornithosis complex. One of the most important dreaded respiratory affections is ornithosis. Ornithosis is provoked by a small bacteria, the Chlamydia psittaci. This bacteria can be identified by taking a sample from the eye. It is often thought that ornithosis limits itself to an infection of the respiratory tracts. This certainly isn't true. Internal organs also, such as the liver and the spleen, can be affected. Pigeons which are affected with ornithosis are drowsy, look swollen, have little appetite, have a poor plumage, lose weight, and produce watery green droppings. When young pigeons are involved, mortality may even result. One can recognize ornithosis externally through the following symptoms: watery eyes, dirty nasal cere, mucus discharge from the nostrils, throat inflammation, a swollen head, and often a difficult breathing with open beak. In severe cases, a rattling can be heard. Typical for an ornithosis infection is a one-sided inflammation of the eye membrane accompanied with heavy tearing. When dissection is performed, an enlarged liver and spleen are mostly established. It is a known fact that many pigeon loves are practically continuously confronted with ornithosis. In such a dragging disease situation, the symptoms are never quite evident. The pigeons cannot be brought to an optimal condition. They perform poorly and losses are gigantic. When breeding in ornithosis situations, splendid results are also not to be expected. Infertility and a low percentage of hatching are then established. How can one now efficiently combat ornithosis? Tetracycline is still the best medication for treating ornithosis. From this group antibiotics, doxycycline is the most recommendable product for the treatment of man and animal. For pigeons, the preparation Ornicure was especially developed. It contains a high dosage of doxycycline. An ornithosis treatment is one of long duration. This is necessary to kill the germs present in the deep internal organs. To obtain a successful result, the treatment should be persevered for at least 4 to 6 weeks. The disease returns, and the ornithosis problems are even stronger than before. Besides chlamydia, the pathogen of ornithosis, there are other bacteria and viruses responsible for respiratory problems in racing pigeons. These affections are often called the swollen head disease, or coryza, or snot. In most cases of infection, we observe inflammatory eyes, dirty nose cere, and repeated sneezing. The pigeons scratch their ear, eye, or nose with their foot and often shake their head. The plumes around the nose cere and the eyes stand erect. The plumage is no longer smooth and shiny, but feels dull. The mucous membrane of the throat, which is normally pink, becomes blue-red. The beak slit is mostly closed. The pigeons are gasping for breath, especially after physical exertion. The eyes are half closed, and the edge of the third membrane is visible. A coryza affection should be treated as rapidly as possible. Antibiotics are especially recommended. For these respiratory affections, it is also preferable to use ornicure. To obtain maximal efficiency from an ornicure treatment, a few supplementary measures must be taken, such as avoid using calcareous tap water, remove minerals and grit, do not participate in competitions during the treatment. The average duration of the treatment is 5 to 10 days. Relative to respiratory problems in racing pigeons, we would like to give you a few points of advice. Besides the administration of a treatment in the case of respiratory problems, attention should also be paid to the housing situation of the pigeons. A few prerequisites are: keep the loft dry, warm and free from draught. The front of the loft should preferably be facing southeast. Windows are bad insulators, and large window panes will make the loft sensitive to temperature fluctuations. It is also good to make sure that not too much rain or snow can penetrate joints or cracks. Roofing tiles still form, according to us, the best roof covering. The air inside the loft must be able to escape through the roof. If the roof is covered with corrugated sheets, a special ventilation should be installed. Avoid overpopulation. Preventive treatment against respiratory infections is useful. Besides administering anti-trichomonas preparations at regular intervals, the giving of antibiotics can suppress respiratory problems during the racing season.